Good morning, good afternoon, good evening, everyone, depending on where you are from. Thank you very much for joining us at today's CTN Translation Studies Research Seminar. CTN stands for Center for Translation. I am Clara Chuan Yu. I am an assistant professor in translation studies at Hong Kong Baptist University. I am also a research fellow at the Center for Translation, also at HKBU. Today, it's our great pleasure and our honor to have Professor Meylaerts, my apologies for the pronunciation, to be our speaker today. Professor Meylaerts, she is a full professor in the Department of Translation Studies at KU Leuven. She served as vice rector of research policy from 2017 to 2021 and as a vice rector of social sciences and humanities from 2021 to 2025. Her research focuses on transition policy, which is what she's going to talk to us about today, related to minorities, intercultural mediation, and cultural transfer in multilingual societies, both historically and today. She has authored or edited approximately 150 articles, book chapters, and books on these subjects. Professor Meylaerts, she was keynote speaker and invited expert at some 40 international conferences and workshops. She has been lecturing at many universities around the world, including Harvard University, Beijing Foreign Studies University, Beihang University, Copenhagen University, among others. Now that list expands to Hong Kong Baptist University. She has been coordinating national and international research projects and supervising more than 20 doctoral students. Professor Meylaerts, she was director of CITRA, which is, I trust we are very familiar with, Center for Translation Studies from 2006 to 2014. She's now a board member. She is also former Secretary General between 2004 and 2010 of the European Society for Translation Studies. Without further ado, the floor is yours, Professor Meylaerts.
Yes, okay. Thank you for this kind introduction. Thank you also for having me here. The first thing I need to do is to share my PowerPoint. Let me try.
Great.
So welcome to everyone. From most people among you, it's in the afternoon. For those people perhaps from other places, as I've seen, it's in the morning. Anyway, welcome here. I'm very pleased to see so many people present. I will try to speak for about 1 hour, perhaps a bit more. So as to give you plenty of time also to ask questions, to have a discussion. I'm really looking forward to that. So my talk of today, you have the title here in front of you, and I will not repeat that. In fact, it is about a research project of which you have the title here. Language is a barrier or is not a barrier towards effective translation policies and practices for official communication with culturally and linguistically diverse communities in Brussels and Melbourne. That was the complete title of the project. It was carried out by 2 doctoral students, Kadisha Boris-Zorin and Rachel McCready. They have both finished their PhD in the meantime, so the project is since December 2025 is finished. And together with Anthony Pym, I was supervisor of the project and of the 2 students. So for today, I will focus on COVID-19 pandemic in Brussels. But, and I think that's important, I think, and I will try to show also that this case of COVID-19 and Brussels, that it is to a large extent symptomatic for worldwide patterns, and I will try to show that with references to other studies. So even if it is about Brussels, it is a very small city, it's the capital of Belgium, but even if it is about Brussels, this very small city in Belgium, I think, and I hope this will be the case in your eyes also, I hope that it is about so much more than Brussels, that there are patterns that you can recognize perhaps in your own research or in other people's research. And that's also why in the end, as a conclusion, I will try to make some general conclusions, what this means for translation studies. So that's in a nutshell what I try to do today. Yes, let's start. As you can see from the title, it's important to start with the definition of translation policy. So the first question is, what is translation policy? Of course, as you know, I guess it can mean very different things, or there are a lot of definitions. I work here for this lecture. I work with the definition of translation policy that has been taken from the definition of language policy by Spolsky, and that then has been adapted by Gabriel Gonzalez Nunez and also by myself. So it has been adapted to translation policy. So this is the definition of translation policy with which I will work today. So policy refers to the legal efforts by authorities. That's important. It's in fact, that's a very specific element, but it's the legal efforts to initiate, to impose, or to refrain translation practices. Translation practices, well, these are the actual activities that ensure communication between the authorities and the people. Also an important point, something very specific. So all I will be saying is about official communication. It's not about private communication between two people meeting in the street or wherever. It's about how the authorities communicate with the population and vice versa. So it's a very specific viewpoint. Translation practices, meaning all kinds of all types of translation, including interpreting, but also adaptation, sign language, machine translation. I will just mention translation, but it's of course good to remember that it will refer to all these different practices. And then the translation beliefs, these are the values assigned by members of a language group to translation. What do the people think? And also what do the authorities think of translation? Here, as it was also in the project, focused on trust. Do people trust official translations? You might imagine that in a crisis such as COVID, that this is an important aspect. So that's the definition that I will work with. I like this definition because you can divide it into three parts, so to say. I would like to refer here also to what Spolsky was saying, and it's important that in order to be effective, translation policy, or policy in general, but here translation policy, in order to be effective, it must be consistent with the practices and the beliefs. So there is a really an important relation between the three aspects. You can, as a researcher, you can research them, and you should. I think it's interesting to do research on the three aspects, but the relationships between the three elements are important, because when the policies are not consistent with the practices, for instance, they will not be effective. So that was also an important element of our project. At the same time, another remark, there is no guarantee of any direct causal relationship or any exact matching between the three elements. So they are in a let's say, a complex relationship among each other. As we know, our relationships in the humanities in general. So don't think of causality, because that's not how things are related. Once again, in the humanities. So this as an introduction to what kind of definition I give today to translation policy. And as I've said, the specific focus will be on Brussels, which was one of the cities which we worked on in the project, the other being Melbourne. I chose Brussels, of course, because I'm living there. It's my context, so to say. But as I said, it's important to reflect how that relates to other places. Now, in any research that one is doing on policy, on translation policy, it's important to know what is the linguistic situation. And that's also why I would like to start with a small overview, a quick overview of languages spoken in Brussels. What is the linguistic landscape in Brussels? I give you here the numbers of 2025, the most recent numbers. Brussels has a population of approximately 1.2 million residents. In your eyes, a very small city. In my eyes, in Belgian eyes, it's our capital, it's our main city anyway. No, that doesn't count so much here. It's more interesting and more important to know what is the origin of these people. So as you can see here, I will give you the percentages. That's even clearer. 39% of Brussels population is of Belgian origin, 25% of EU origin, speaking already very different languages, and 35% of Brussels inhabitants come from outside the EU. There are no less than 186 different nationalities that live together in Brussels, and that makes Brussels, I think, the most recent statistics I've seen, the second most diverse city in the world. It seems perhaps a bit odd, such a small city in such a small country. Anyway, I think it's good to remember that it is a city with a highly diverse population. So far from let's say the nationalities of the people, the background in terms of nationality of the people. More important is to know what languages are spoken at home. If you want to assess the effects of language and translation policies on the residents, wherever you are doing your study, it is really necessary, it's crucial to identify which languages are spoken at home. Why is that so? I think you are aware of that as much as I am, because the language that you speak at home is the language that you have acquired at a young age, and that is the language that you strongly relate to, that you strongly identify with. And it is also the language to which you resort in emergency situations, in stressful situations like COVID. So this was an important viewpoint for us within our project, and I think it's also very important for other types of research or similar types of research on other places. As you can see from this latest language barometer, yes, sorry. There are no official language censuses in Belgium. That's something that I give you as a footnote. It's politically too sensitive. But colleagues of mine at other universities, they do these statistics, and every so many years they publish their language barometer. You see the evolution, but that's not so important from here. The latest language barometer was 2024, and you see here that French continues to be the main home language. either spoken as the sole home language, or together with Dutch, or together with another language. So in total, 63% of the households in Brussels have French as the or one of the home languages. Dutch is spoken by very few people as a home language, for 4.3% as 7.5% as the sole home language, or together with French, or together with other languages. But in total, and I think that's important to remember, is that it is only for 12% of Brussels residents the or one of the home languages. So keep that in mind, not the percentages, but French and then Dutch. And then also 1/3 of Brussels population, sorry, I clicked too early, 1/3 of Brussels population doesn't speak French or Dutch at home. That is the important number to remember for everything that will follow. And now I need to switch to the next slide. So what are these other languages that are spoken at home? Well, they're one of the main languages spoken at home is Arabic. And that will, of course, be an important language for us in the following. Among 10% of the people living in Brussels have Arabic or one form of Arabic as their home language. And it is crucial, it was crucial for our project to know that many people in this group, they face challenges related to health literacy or linguistic skills, especially in stressful or urgent situations such as the COVID pandemic. And I will come back to that because this was, of course, object of our study. What is important to remember for now is that Brussels is a super diverse region, linguistically speaking, and I think we as translation scholars, we would expect a big role for translation and for translation policy in order to grant access to public services. Communication between authorities and people is about access to public services like health services. Okay, so far for the linguistic makeup in Brussels. I'm a bit, yes, I'm struggling with my different screens. Sorry for that. So far for the linguistic makeup in Brussels, what then about the institutions that regulate translation or not? So what are the specific language and translation policies in Brussels? For people not familiar with the Belgian situation, and I guess no one is, why should you? But we are a country with a quite complicated political structure, which I will try in a nutshell to explain to you. I need to explain it to you, so please bear with me, because the political makeup or the situation, the institutional situation is very much related, or is in the first place related to the linguistic institutions and the language and translation policy in Belgium, but also in Brussels. Anyway, I will try to explain to you in as simple as possible way. So the question here is, and I think that question is important to ask in any type of research on a language and translation policy: which institutions do regulate the provision or the non-provision of translation here? Which institutions have the power to regulate that in Brussels? Now, as I said, it is closely linked with the federal constellation in Belgium. So I need to start with the organization of the federal state of Belgium. Belgium as a country, I have told you, it's very small, but it is an officially trilingual country. So you have Dutch, French, and German as the three official languages. And why is the federal level important for everything that will follow? Because the federal level is competent in terms of powers for social security and for very important parts of public health. Public health, COVID, so you see the link. So this means that at the federal level, all official communications need to be in the three official languages, Dutch, French, and German, and translation is, as a consequence, essential to Belgium's governance. Now, as you see on the slide, this federal state, very small, once again, is composed of three regions. At the bottom of the slide, I start there. Of which Brussels capital region is one region. Perhaps a bit strange to call such a small city a region. Anyway, it has the status of a region, and this region, so the Brussels capital region, I will speak about Brussels, but I always refer them to this Brussels capital region, and this region is officially bilingual, Dutch and French, and that implies that all official communication from the Brussels authorities to their population needs to be available in Dutch and French. And once again, translation plays a major role in Brussels governance. It's not finished yet, so please bear with me. This federal state is also composed of three communities, and these communities, the Flemish, the French, Flemish in the north, so I'm now at the top of the slide. These communities are officially monolingual. So the Flemish community in the north, monolingually Dutch, the French community in the south, monolingually French, and you have a very small German-speaking community. You might even forget, sorry for the people living there, but you might forget about that community. It will not play a role here. But communities have competences for the use of languages, for aspects of health policy, for social welfare, and so on. And as you can see on the slide, the Flemish community exercises its competences not only in the Flemish region, but also in Brussels, and the French community exercises its competences not only in the Walloon region, but also in Brussels. And that's the summary. If you are lost, and I completely understand, but if you are lost in the meantime, important to remember is that for Brussels, it is Brussels, the federal government, and the Flemish and French communities who have responsibilities regarding language and translation policies in Brussels. So let me repeat that. It's Brussels, the federal government, and the Flemish and French communities who have competences for language and translation policies in Brussels, including during COVID. So in a very small city, in a very small geographic area, you have all these institutions that have responsibilities. So these responsibilities are distributed across multiple competence levels, meaning that there is no unified language and translation policy in healthcare. And this results obviously in fragmentation, in unclear guidelines, in overlapping practices. And in crisis situations like COVID, and this will become clearer later, but these factors may, of course, affect how authorities communicate with the public, as I said, as we'll discuss further. Now, if you remember Brussels' diverse linguistic fabric, so to say, what you have seen until now, it was about French and Dutch. So what we know already by now is that language and translation policies do not address these linguistically diverse populations, do not address these called communities. Public services are not mandated to provide services in languages other than Dutch and French. So Brussels language and translation policies are basically concerned with the rights of the Dutch speakers and the French speakers. And I could speak for hours about the different rights they have. In practice, I mean, they have the same rights on the policy level, but in practice it's different. Okay, that will not play a role here. But the called community, so the linguistically diverse communities, they are not addressed or they have not access in other languages than Dutch and French to these services. So the question then is, and that was the question of our project, how did these communities manage the crisis? What did authorities do when COVID-19 was going on? Well, in September 2021, so in the full COVID crisis, there was a special parliamentary committee charged with investigating Belgium's management of the COVID-19 pandemic. And this committee presented its report. It was a long report, 581 pages, and only at three moments, in very vague times, there is a mentioning of multilingual communication. And I give you the quotes here. I translated these quotes from Dutch. As you see, following the law, the report is in two languages, Dutch and French. We are at the federal level. But the important thing to remember here or to focus on here is that there is nothing about translation, let alone about translation policy in this report. You see some very vague references to people who speak other languages, including sign language, verbal groups, and so on. Another reference at the same page to people of foreign origin, and once again, different languages. But that's it. There is no other reference to any kind of multilingual communication. So I think what this report already tells us is that in times of crisis like COVID, there is authorities tend to treat the population as linguistically uniform, meaning bilingual here, Dutch, French, neglecting to implement multilingual strategies for crisis communication. No reference to multilingualism in crisis communication. And unfortunately, Belgium and Brussels are not unique in this regard. This is only a snapshot from other studies, and some of these studies might be familiar to you, but these studies, there are many more, they show similar findings. Although access to potentially life-saving information in multilingual communities' native languages is increasingly considered as a human right, translation is often missing from the early stage of emergencies, or translation is only available in a limited number of languages, which does not match the complexity of the linguistic landscape. True for Brussels and true for so many other situations. Translation is found to be theoretically essential, but practically ignored. A practically ignored part of crisis communication in these multilingual contexts. So there is a big need, also these studies find, to truly incorporate translation into government's crisis communication strategies. That's a big need. I really want to stress that. Studies also confirm that crisis managers cannot continue to make abstraction of the multilingual and multicultural needs of crisis communication. They should abandon a one-size-fits-all approach. We see that happening everywhere. And together with O'Brien and Federici, which is one of the studies that I refer to here, I also would like to call upon the responsibility of ourselves, researchers in translation studies, because in my view, O'Brien and Federici rightfully state that the literature, I quote here, the literature that deals with the multilingual nature of crisis situations is limited in fields where it should thrive, such as in crisis communication and in translation studies. End of quote. And therefore, O'Brien and Federici propose a shift of focus towards considering language and translation as part of disaster prevention and management. I think that's very much needed, and I think it's also our responsibility as translation studies scholars. It will be an uphill battle, but I think we don't have the luxury not to, let's say, fight this battle, of course, figuratively speaking. And this brings me back to Brussels and Brussels' bilingual policy, everything in Dutch and French and only in Dutch and French. And quite some experts have described this model as outdated, both during COVID and more general. And they plea for what they call a radical overhaul that would diversify the city's official languages, for instance, turning to English. But I told you before that it's even politically too sensitive to do language censuses in Belgium. So you might imagine how sensitive this kind of recommendations or this kind of viewpoints are. And so given the political sensitivity of the issue, there has been no change, there has been no progress in the official language and translation policy in Brussels. I would say even during the COVID crisis, policies stayed the same. But then the question becomes, how did the practices implemented during COVID align or not with the existing policies? So I remember official policy Dutch and French. So what did happen during COVID? What was translated and what not? So we turn now to practices, the second part of the definition. And I first consider with you the official translation policies during COVID. What was translated? Well, this is from an official website, and you see the English. So what does it mean? Authorities exceeded their established policies because they provided official communication in languages other than the official ones, like here in English. There was more translation than there was allowed by the law. Practice preceded policy, and the policy was thus not efficient. That's the proof that policy was not efficient. Practice preceded policy, but policy didn't change. And thus, as I said, there was a clear mismatch between policy and practice. But as a result thereof, practices remained ad hoc. There was no structural embedding in policy of the practices. There were no institutional guidelines ensuring continuity, efficiency, clarity. And I would like to give you two examples. The first of which you find here. This is an example from the Brussels website, the COVID-19 website at the time, where you see that Brussels used English as a lingua franca next to French and Dutch. And so that is to say that the Brussels authority undermined, in a way, if you consider it from the policy viewpoint, from the legal proof viewpoint, they undermined their own language and translation policy. Example number 2, the federal government website is bilingual, as it should be, according to the policy. And let me give you the translation of what you find here in Dutch and in French. So in English, it would read, on this page, you will find posters, information sheets, audio files of the official coronavirus information in Belgian national languages. And then, most of this information has also been translated into various foreign languages. The available information is organized by language. An overview of the different languages can be found in the table, which came then below. And the audio files, so there is also audio files, always contain concise information in simple languages. So there is a lot about translation, but implicitly here. In fact, this website presented information in more than 20 non-official languages. So a huge translation effort, and here you find an example of how this information was presented for Arabic. But I think here many remarks should be made from a translation perspective and from a viewpoint of accessibility, which I try to organize in 4 elements. For me, there are 4 things that are striking in these examples from government websites. So this is the official communication, Brussels or federal, as I told you. My first observation: translation practices vary by competence level and often contradict each other. And this, of course, can be especially problematic during crises like COVID, where reaching these communities is of key importance. That's my first observation. 2, authorities were well aware of the fact that translations into non-official languages were illegal, but they turned a blind eye to it. And in my memory, it's really one of the first times that they really do it. So they turned a blind eye to it, but just for the time of the pandemic. Obviously, and I think rightfully so, necessity knows no law. People were dying. But this, and this is in my viewpoint even more important, this also indicates that under ordinary circumstances, in non-COVID times, authorities know that multilingual communities may not have equal access to public services. But for the authorities, the protection of the status and the position of the official languages, French and Dutch, prevails upon the linguistic rights for the multilingual communities. It's only during this short time of the COVID pandemic that they went beyond their official policy. That's my second observation. Observation number 3, access to COVID-19 information is typically provided through a lingua franca or the official languages, Dutch or French. Remember the example. Now, as we have seen, approximately 1/3 of Brussels' population speaks a home language other than Dutch, French, or English. That's a lot of people, 1/3. And this means that their capacity to use these languages really declines in stressful or in emergency situations. And there is a lot of research on that, the fact that your L2, your second language, declines in these situations. And that means that significant segments of the population may face barriers to accessing essential services. So even if you provide a translation in English, it's not enough, I would say. Okay, observation number 4, specifically for the Moroccan population of Brussels. Remember, 10%, at least 100,000 of people, only a selection of materials was translated, as the website told us. And the translations addressed these Moroccan communities in modern standard Arabic. But these communities, they do not speak modern standard Arabic. They speak the Moroccan variant, or they speak even Amazigh, so other languages. So these communities were likely not to understand the official communication. And remember that they first should have still some capacity in one of the official languages to reach the information in Arabic. Conclusion for Brussels: called communities, so the multilingual communities, were not reached. And you find evidence hereof in the vaccination statistics. That's one of the ways in which you can see if communities are reached or not. Here is a first example. I once again give two examples. There is a report by the Belgian Health Institute. We are October 2021, which shows that some of the lowest vaccination rates in the country were in the Brussels municipalities, where people with a Moroccan background were living. So these communities were not reached. 1 year later, still the same situation. We are September 2022. Only 62% of the Brussels population was vaccinated, and this was a rate that was well below the national average. And once again, Brussels, unfortunately, was not an isolated case. Also, other studies have revealed that translated materials on government websites missed their goal because community language speakers were either unaware of these resources, or they needed to be first literate in the official language in order to access the translations, which is a complete contradiction, which in fact is completely nonsense, I think. Now, what then happened? How did the Brussels authorities cope with the situation, knowing, and the statistics were official, knowing that these multilingual communities were not reached? Well, here we need to turn to community-led practices. The gaps in the official communication with the multilingual communities were addressed by people from the communities themselves. And we have observed a whole range of actors. So who was involved and where was it happening? That is the question that I am tackling now, in then trying to reach these communities. I will give you a few names. The names themselves are not so important, but these were the organizations, the community organizations that were involved in then trying to reach these people. Brussels Accueil. This is a non-profit organization that provides interpreting and translation for health services. And in 2021, and I think this is interesting to mention, in plain COVID crisis, more than 35,000 translation and interpreting services were delivered by Brussels and Melbourne in 101 languages, and this mainly through the work of volunteers. Volunteers who do not necessarily have a formal education as translator or interpreter. I think this rings a bell for us translation scholars. Volunteers were doing the job during COVID. Similarly, another organization very important in Brussels, a non-profit, Foyer, which is based in the heart of the Moroccan community, and they also produced COVID vaccination information videos, not only in modern standard Arabic, but also in Amazigh or in Larisha, which are the varieties that these communities speak. So also Foyer did an important job, non-profit organization. Another nonprofit, such as Doctors Without Borders, they created what they called MobiVax, which was a pop-up vaccination initiative targeting, once again, these multilingual communities. And once again, MobiVax called on volunteers and called on its own staff who spoke the community languages to interpret vaccination information on the spot for members of these communities. Next to organizations, healthcare providers such as family doctors, pharmacists speaking community languages also played a central role, thanks to their not only physical but also linguistic proximity with the community members. And our research showed that they were instrumental in helping community members to decide about vaccination. Once again, these are not trained translators. And this made that gradually Brussels authorities also turned to these community members for help. So the Brussels Health official institution, the Brussels Health Inspectorate, it is called, which was responsible for vaccination, announced in July 2022 that they were working closely with priests also and with imams, so the religious people who could communicate with the community members in their home language. And this, once again, together with local volunteers, they held vaccination sessions in mosques. To get people vaccinated. Another initiative, and that's one of the last examples that I will give, was that there were vaxibuses. And the name explains what it is. So buses moving around in Brussels in collaboration with local community members who spoke the community languages to get people vaccinated. So these buses went to strategic locations in the heart of the Moroccan community in Brussels, and they vaccinated thousands of citizens, in fact, of over 100 countries, so not only the Moroccan communities. So I think to summarize here, but these were only some examples, all these community level initiatives brought together local authorities, community volunteers, and nonprofits to fill in precisely some of the gaps that were left by the official bilingual policy and by its ad hoc translations. And that is, not surprisingly, I think, what we see happening in other places with different language and translation policies. These studies share similar findings and give us a picture of what is happening a bit around the world during COVID. These studies, and again, only a snapshot, they also point to the increasingly important role played by volunteer translators during crisis. They also point to the need for tailored messages at grassroots level. They point to the need to engage with religious or cultural community leaders or representatives because they are considered as reliable sources of information. With key information also given at religious gatherings, so in a verbal way, not in a written way. Now, from a translation studies perspective, it's important to notice that this doesn't mean, or this shouldn't mean automatically that professional translators should be replaced with volunteers. It means, in my eyes, that both should work together and should work together constructively to reach the multilingual communities and to empower them. But what many studies in crisis communication show is that there should be this collaboration, and that non-professional translators really are a much needed aspect of crisis communication during a crisis like COVID. And I will come back to that. So if you still bear with me, this was a first element of the non-official practices. Who is doing it and where is it done? I have not spoken until now about how this was done, because there also, I think it's important to speak about that, because there also you see quite some difference with these official practices. So how did these community-led translation practices were delivered? Well, an important aspect of their of these practices is their multimodality. What we saw in happening in Brussels is that community members, they posted or reposted translated messages on the social media preferred by the community. One of the most preferred elements or means, was WhatsApp. WhatsApp, especially for low educated people, the voice messages in WhatsApp, not the written messages, so voice messages through WhatsApp, which were reaching especially the people with few networks and people with few access points to the official information. So what you see is that there is a kind of intersemiotic translation or adaptation. These people converting print text, so web text, but text messages, to re-narrated spoken audiovisual communication. And this was an important element for reaching these people. I have spoken about Foyer. This is what an example of what Foyer did with the help of community members. They adapted public health information to multilingual videos. So once again, not only the written form, but also the spoken and video form, which were then able to reach many more people. They also did WhatsApp voice recordings, and they were present, but I've spoken about that, at mobile vaccination points. Important. An organization like Foyer did so not only in modern standard Arabic, but also in Moroccan and other variants, something that the authorities or the official communication did not do, and which was so important for complementing these official policies and for increasing community access. So our research, to summarize a bit here, our research showed that written text formats alone are not sufficient. Multimodality is crucial because of low literacy, also low digital literacy. The two play together, of many of these multilingual community members. And what we see happening in Brussels is that this multimodal, non-written, multilingual communication delivered with the help of community members, volunteers and non-profit organizations, realized what the official policy was not able to do. That is, granting access, hopefully granting equitable access to COVID-19 information for these multilingual communities in Brussels. And once again, similar things were happening in other places in the world, like New Zealand, like Australia, but other places. Here, once again, a snapshot of similar or studies with similar findings, where multiple platform approaches including local community radio, SMS, digital platforms, social media such as YouTube, also WhatsApp, WeChat for the Chinese community. Sometimes also with the help of influencers, these elements proved especially efficient, as illustrated by these studies. Studies indicate, moreover, that this kind of inclusive communication should not be limited to times of health crisis, but should rather be an essential component of a sustainable, inclusive, and democratic society, because a fair language and translation policy should strive for equal access for all, and this also beyond a period of crisis. And this for me was very painful in a way to see that not only in Brussels, but in so many other places all over the world. In fact, we didn't find any place who adapted after COVID their language and translation policy. So after COVID, things went back to normal, but normal in between brackets, because what is normal? It's not sufficient for for accessibility for services for multilingual communities. So that's really something I think that should be worked upon. Okay, third element and last element of the translation policy, as you remember from the beginning, are the beliefs. Did people's beliefs align or not with the policy? This is very important, because if there is no alignment, once again, the policy will not be effective. We know already that the policy in Brussels was not effective, but it's still important to see if people in these multilingual communities, in our case, the Arabic and Amazigh-speaking Moroccan populations of Brussels, did they trust the COVID-19 messages? As translation studies scholars, we know that when the messaging is mediated across languages, the act of trusting becomes not only harder to achieve, it is also technically doubled. One can trust or not the source of the message, here the government, the official communication, and one can trust or not the mediator, the one who delivers the message, in our case, the translator. So the last part will try to give you a view on the trust in the messages in Brussels, but I first zoom out a little bit and show you here the Edelman Trust Barometer 2021. It's about trust in information sources worldwide, and you see that trust in all information sources had reached record lows globally during the pandemic in 2021. So overall, worldwide trust in all information sources went down. It's typical for a crisis situation, of course, but it's important to keep that in mind to try to have an effective policy. Second source of information about trust that we used was the Vaccine Confidence Project, which also found that in 2022, the percentage of respondents agreeing that vaccines are safe was up to 75% in Belgium. So there was a high confidence in the vaccines being safe. Also, vaccines are compatible with my beliefs, reached a high score of 74% in Belgium. This is not about Brussels, this is Belgium worldwide, but I think that it can still give an indication. Other studies for Belgium found that people who trusted the government in its dealings with COVID-19, or who trusted the experts who advised the government, they were I think obviously they were more open to vaccination than those who did not. However, none of these studies, and there are more, but none of these studies considers language mediators as a possible variable. I think I hear some voices there. Let's go on. So none of these studies considers language mediators to be a variable of trust, and that is what we focused on in our study. So we asked whether the increasing integration of community-based translation practices, if that changed the nature of trust, potentially moving from thin trust, which is invested in trained translators, translators whose authority is narrowly confined to a professional code of ethics, if that thin trust moved to thick trust, accorded to community-led practices, to community-based mediators whose credibility is grounded in broader social and ethical relationships. And this, of course, is important for the general relation between trust and translation, because a preference for thick trust may question the reliance on professional translators. You know, community-led practices, professional translators. So there might be a questioning of this reliance on professional translators. Now, what does that mean for Brussels? In Brussels, the community health workers, so we did interviews, and you find these quotes also in some of our publications. But in Belgium, the community health workers saw themselves as actively creating trust. You see it here in a quotation from an interview. People like me can be bridges with cultural communities. It is very important that people like me, so this is a community mediator, people like me can be open, we can understand what the situation is in the minds of other people, we can try to reduce barriers and maintain proximity or distance, but still building the trust relationship. And another important finding was that from our interviews, it was revealed that trust was less related to what was said or which language was used than on who was providing the information. As you can see here, a Mahmoud from Marrakesh, he lives in Schaarbeek. This is one of the communities of the Brussels region. This person asked Manu, she's from La Louvière, she's blonde, she's beautiful. And so this person asked, is the vaccination halal? If she, so the blonde and beautiful girl, said yes to him, he will definitely not be sure that this is true. But if he comes to me as Muhammad, even if I don't pray, if I don't even follow any religious practices, even because my name is Muhammad and my skin is a little bit like the Moroccan skin color, he will believe me if I told him it is halal, and that's it. So who is giving the information is important. Now, on the other hand, we also know that translators, professional translators, have this very important code of ethics calling for non-advocacy, for neutrality. And these codes should ensure that the public trusts the translators. This is the same in Belgium and in Brussels. This trust in the professional translator should be there independently of who a particular translator is. All translators become the translators. Now, as we have seen in Brussels, while professional translators and interpreters were involved and they were certified, much of the mediation work was carried out by the mediators, which were themselves embedded within the community. So, at first sight, it was tempting for us to align thin trust with professional translators and interpreters and thick trust with community mediators. And then to surmise that COVID-19 saw a shift from one extreme to the other. But our interview data nuance that reduction, because it is a reduction, and we found nuances in several instructive ways, and that is what I would like to share as my final part with you. For most of the community mediators, thick trust does not involve advocacy in the sense of pushing the agendas. It was more, as we saw, a question of seeing things from the perspective. Remember the quotation. So seeing things from the perspective of the community member, ensuring that information is available in a way that is accessible to them. Think also of the multimodality. Making sure that community voices are also heard in the communication process. And we saw community-based mediators not only fostering thick trust, what I said, so making sure to have the viewpoint of the community. We also saw them raising personal questions about their ability to maintain neutrality, something that you would associate with professional translators, with non-advocacy. So in our interviews, we found cases in which personal opinions were suppressed by these non-official translators, non-professional translators. They suppressed their personal opinions, because they, in a way, applied what you could call a professional ethics based on thin trust. And so, in this way, we found that the aims of both thick trust and thin trust communication, they can meet, let's say, in one and the same person, at least to the extent that both seek to give equal access to information. Thin trust messaging is the same for all, should be the same for all. Thick trust communication adds adaptation and dialogue to ensure actual access. And we saw people seek a balance between the two, and both look for the same goal, but they do so in different ways. So when we pursue this line of thinking, we find that several trade-off positions appear along this axis that goes from thick to thin trust. So it's not, we should not associate, as I said, thin trust with the professional side and thick trust with the non-professional side. There are some trade-off positions along a continuum. One point would be where, as we have found in our interviews, accurate official translations are needed for technical terms, and community adaptation is needed for everything else. Another point would be where an official translation is received by the community mediator and then adapted to specific groups and needs, which we actually saw happening in Brussels and which is also found in other studies. Another point is where community consultations happen prior to the production of official translations, which is recommended also by other studies. And I think this is a way forward that we should not forget. This is also something that we should apply or try to make the officials apply in non-crisis times. So proactive development and dissemination of multilingual resources is essential to ensure inclusivity and trust, even in non-crisis situations, as I've said. So in the end, what we found is that both thick trust and thin trust have their roles to play. The more one seeks thin trust, the less one can be sure that the information is understood and can be acted upon. And the more one seeks thick trust, the less one is sure that all citizens are receiving exactly the same information. So once again, one should seek a balance between these two extremes, and I think there we have some work to do as translation scholars. So that in a nutshell for the beliefs focused on trust, and here I come to my conclusion, which I see as a kind of zooming out, formulating some more general recommendations concerning the role of the translator, the practice of translation, the definition of translation, and the discipline of translation studies. What, in my viewpoint, can be concluded on more general on a more general level, for first of all, for the role of the translator, our observed successful collaboration between professional and non-professional translators, volunteers, community members, organizations, makes us aware of the fact that a translator does no longer work between two languages, but I would say between many contemporary parts of social life, and we should incorporate that. And of course, it's already done in many practices and also in many studies. The implications, of course, are important. The implications might be far-reaching. We not only need an expanded definition of the translator in order to overcome this binary, because it doesn't work in practice, this binary between professional and non-professional. We also, I think, need to adapt our education programs, and this is already happening, and reflect about our codes of ethics. So that are some points I would say we should take further in translation studies. So far for the role of the translator. The practice of translation. We have seen many examples of translation operating within very specific political, institutional, demographic settings, hence the need to factor in these settings proactively, not reactively only, but proactively together with all the stakeholders. And this is not new, and this is already and luckily so happening, but crisis situations make us aware of the fact that there is still a way to go, at least what we saw in Brussels, and still what is observed in many studies. Now, the other way around, the observation that effective practices during COVID were similar in a way, or the same even, across many different settings, also across many different official policies. This, in my view, should also encourage policymakers to adapt their policies accordingly. It should be adapted in the same way, in a similar way, for all these different situations. And since communication today implies a combination of different media, more and more, I would say, it is also essential that translation, let alone crisis translation, transitions from mainly text-based practice, what we still saw happening in Brussels, so transitions to a multimodal practice. So we need new translation practices. We need multimodal translation as a necessity. And once again, this is happening and this is being studied. Okay, for the definition of translation, I start with these multimodal translation studies and the important developments that are going on there. They have already changed our idea of what translation is. And as I've said elsewhere, we need this expanded definition of translation due to an increased combination of semiotic modes in our digital age, meaning making the concept of translation has changed. The concept of translation has expanded. So translation should not only be defined in linguistic terms, but also as a semiotic process that takes place in and between humans and non-humans. Think of the machines, think of the online platforms and so on. So it is involving translation, as we all know, is involving much more than written text and much more than the traditional binaries. Such an expanded definition does not mean that everything is a translation, but that many things have a translational dimension and that they can be better understood if this dimension is taken into account. And then lastly, for the discipline of translation studies, obviously our study has shown, I think, that more interdisciplinarity is needed. There is no single disciplinary framework that can be an adequate approach to our multimodal world. And if we want to have impact, I think that whereas descriptivism has for a long time dominated translation studies, research in translation policies, among others, makes us aware of the need to develop the applied branch of the discipline and to develop it more because it is already happening. If we want to help authorities and policymakers in developing a fair language and translation policy, we cannot remain neutral. We do not have a choice between freedom and regulation. We do not have a choice between neutrality and engagement. But we must choose between different forms of regulation and engagement, between different translation policies. And this choice needs to be informed by our research, I think. I will end here. Thank you for bearing with me, and I'm really looking forward to your questions. I think I'd better stop sharing the screen. Yes?
Yeah, sure. Thank you very much for a very inspiring presentation, Professor Meylaerts. Can we give another round of applause to our speaker before we close the floor? Thank you so much for.
And I would like to take the opportunity. Thank you for inviting me, but especially also thank you for the interaction here, which is so much worth for me, so valuable. So thank you very much. I learned as much as you did. So thank you, and have a nice day or a nice evening wherever you are.
Yeah, have a nice day, evening, everyone. We will upload the recording to the center's YouTube page, and we will also paste the center's website to the chat box. Thanks again. Bye.